I always, as a speaker, I always like to give people a heads up on what I'm going to go into. So these are the learning objectives. This is what academicians like me, faculty, like to do when we do scientific talks. So I'll be briefly talking about vitamin D, which if you're not familiar with the importance of vitamin D, I think you will appreciate it at the end of this talk. And what does the current science say about cancer prevention? There's a lot of data saying that we don't need physicians to prevent cancer. It's all on us. And really talk about clinical and phenomenological, which means personal experience. We always talk about scientific research in academia, but we're starting to learn in communities that there's a lot more to healing than just medicine. And just to make sure you know that I have no fees from pharma, I have no conflicts of interest. I'm on social media, so I would love to connect with you. I'm on X, even though I'm not a big fan of the way it's going. I'm LinkedIn, and also have a personal blog site on WordPress that I welcome you to check out. The first question I was asking when I was in medical training is how many people are living with a vitamin D deficiency and don't realize it's completely fixable? And so this question kind of haunted me throughout my trainings, like what are we missing when we ignore these basic life-supporting things like vitamins? So let me go a little bit into vitamin D deficiency. I wrote a free chapter on vitamin D deficiency because the medical textbooks are all wrong. Frankly, they tell you to give a fixed dose, like the 2,000 that my doctor told me to take, and 50% of people who are given this advice will not have good vitamin D levels. So this is creating a real nonchalance, if you will, within the medical community because they're not seeing people get better because they're giving the wrong dose. And what we have now is a real problem. The data says that 70% of Americans are now vitamin D deficient, less than 30 nanograms per ml. And what we notice here on the graph is that severe vitamin D deficiency, less than 20, we usually associate this as a disease of aging, is what doctors are taught. Incorrect. It actually starts to peak at age 10 to 19, exactly when you finish high school. The peak incidence is 20 to 29, so these are our young generation. 70% of our young generation are living with chronic fatigue, insomnia, foggy brain, feeling like they're treading water and barely able to get by simply because of a vitamin D deficiency. So what do we know about vitamin D? Sunshine is our most natural source, but if you have darker pigmentation or if you're an ethnic minority, you're more likely not to get sufficient vitamin D from sunshine alone. And we also know from science that the correct dose is going to depend on your weight and how low that vitamin D is. None of the doctors today, most doctors today, don't even account for this when they tell you your vitamin D dose. So generally, I just want to make a statement. I recommend levels of 40 to 80 nanograms per ml. Why? Because these are the levels that we actually evolved from. When we were outdoor and more foraging hunter-gatherers, we typically were on average about 50 nanograms per ml. And the research says that these levels reduce your risk of developing all the diseases we don't want to get as we get older. Diabetes, dementia, heart disease, diabetes. The same diagnosis that I had when I was only in my 20s. So I wrote this free chapter because it was censored on by the medical publishing industry because they don't want people to know this. So I don't care. So I just published it for free. Everything's now social media. Who wants to buy a textbook to learn about medicine and health? So it's all for free now. So if you want to be an expert on vitamin D, I invite you to check out the blog. Also, just to give you a background of how backwards we are in medicine about vitamin D, currently the medical references that doctors use to up to date, they claim that there are no known symptoms of a vitamin D deficiency. Absolutely incorrect. I did a literature search. These are all backed up by references. These are the potential symptoms of a vitamin D deficiency. Now, how many of you actually have one of these symptoms? Now, how many of you actually know your vitamin D level? Okay, that's not bad. It seems maybe about half. But the point is, you could be dealing with fatigue, depression, headaches, insomnia. I'll talk about infections, vertigo, cognitive dysfunction, muscle aches, like your muscles can't function, anxiety, hair thinning. All that could be simply due to vitamin D deficiency. And I highlight the frequent respiratory infections because just to highlight, we had this thing called the COVID-19 pandemic, right? So the leader of the country, of the medicine, right, Dr. Fauci, he says all we can do on the day of the announcement of the pandemic is wait for mRNA vaccines. 6 months later, in an interview with Jennifer Garner, the famous Hollywood actress, she said, "What do you think about vitamin D?" And this is what Dr. Fauci said 6 months later after he got emergency use authorization for the vaccines. He said, "Oh, yeah, plenty of evidence say vitamin D prevents you from dying from viral pneumonia. In fact, I don't mind recommending it myself. In fact, I do take it myself." So the question is, why is a national leader, a physician, not telling people how to actively protect themselves against COVID-19? It's money. Emergency use authorization gives the mRNA vaccine companies immunity from any side effect lawsuits. And you only can do that if you say there's no evidence-based treatment that exists now today to treat the COVID-19. And so that's the state of this country. It's sad. And like Paula highlighted earlier, there's a lot of conflicts going on in this country because we don't see a government that's really reflecting the interests of the people. So this is a vitamin D calculator. So don't listen to your doctor. My advice is go to this website. This is based on the scientific study that proved vitamin D is a weight-based drug. All you have to do is put in your weight, put in how much you're taking right now, put in the level that you just got tested on and the level you want to go to. 40 to 50 is a safe place to target. And it'll literally tell you exactly what the dose is. Here, you see a pretty conservative dose for a 70-kilogram patient, which is your average weight. But if you're very overweight, you might need 20,000 units. And so what I learned over the last 10 years while I was living in Chicago working for a center called Cancer Treatment Centers of America, what they did was they checked vitamin D levels for every patient coming in and they fixed it before they started treatment. But by doing that, I learned that I was a horrible doctor. I wasn't fixing the vitamin D levels for a lot of my patients because I wasn't comfortable giving the doses they needed. So that's why I wrote the chapter. I wanted doctors to get out of that discomfort zone and start doing the right thing. By the way, that's a scan, so if you scan it, you can get the actual website. But if you just type in vitamin D calculator in Grassroots, you'll find it. So what I want to do is just go a little briefly into what the research now shows about how to stay away and avoid from cancer. This is a slide I like to show because it shows the forest for the trees. In dark blue, you are looking at where breast cancer is at the highest risk. And what you're seeing here is pretty obvious, right? It's the industrialized nations, the modern nations, where you're getting the most cancer risk. And this is not a mystery. The science says it's a disease of westernization. You get a 2 to 3-fold rise in cancer risk if you live in a transitioning country, and the worst risk when you're fully transitioned. And the research clearly shows it's related to very concrete factors: decreased physical activity, suboptimal nutrition, increasing rates of obesity, also less pregnancies. Pregnancy is very protective for breast cancer. And I would also say stress and living in a society where profits over people is the norm is also not helpful. And generally what we expect is that all these transitioning countries that are becoming modernized and more like us, they're going to have 75% of the cancer burden in the future because they don't have the modern care that we do. So what I always tell my patients when they feel guilty about getting cancer, it's not a measure of good health to be well adjusted to a sick society. And so what we want to do as individuals is learn how to become more immune to it. And then I also throw this slide out because it shows where is cancer mortality the worst. And one of the things I want to highlight is that these countries that don't have screening, that don't have the ability to biopsy cancer and diagnose it before it becomes metastatic, unfortunately, in those third world countries, you're more likely to die from the cancer diagnosis. And I also highlight this because sometimes people like alternative medicine, but the research, and they say that biopsies cause cancer and spread. Absolutely not the truth. Biopsy, diagnosis, treatment saves lives. And so I would like to show this slide because if a patient tells me, oh, well, I don't want to do a biopsy because I heard it spreads cancer, I go, well, guess what? In countries where they can't even do a biopsy, you're more likely to see metastatic disease when you're diagnosed. So it just doesn't fit the science and what we're saying. Very briefly, be a healthy weight, be physically active, eat a diet rich in whole grains, vegetables, fruits, and beans, limit consumption of fast foods and high starches and sugars, limit consumption of red and processed meat, limit consumption of sugar and sweetened drinks, and that was honestly one of my weaknesses because I love sugar coffee. Percent drop in cancer incidence, again, limit alcohol consumption. They say do not use supplements, but I felt like that was a pharma-included statement because there's actually some supplements, which I'll talk about, which will help reduce your odds of ever dying from cancer. And also, after a cancer diagnosis, follow the same lifestyle recommendations to prevent cancer, because we're finding that if you do that, you actually improve the cure rate of the cancer. In fact, one study called the Challenge study that came out last year showed that if you exercise for 1 year after your colon cancer treatment, it was more curative than the chemo that we often use for colon cancer. That's how powerful it is.
I can see clearly.